What to expect at pelvic physical therapy. Many women are concerned, fearful, or uncertain about what may happen. I want to share with you what I do with a woman on her first pelvic floor physical therapy. I provide mobile physical therapy, so I come to your home, I bring the treatment table. You bring a towel, a sheet, a pillow, and I bring everything else. I first start by getting to know you. What are your concerns? What are your symptoms? Have you had a baby? Are we dealing with some postpartum changes? Are you dealing with some perimenopause, pelvic pain, leakage of urine, constipation? I ask you a lot about everything between the knees and the belly button, all these questions. There's no TMI, and if you don't tell me, then I'm probably going to ask you a few more questions. After I get that assessment done, then I look at your posture. I have you stand up, I have you bend over. I test your strength for your legs and your posture, and then assess your abdominal and your pelvic floor. With your permission, and if you feel comfortable, then I spread out the sheet. I step out of the room and I say, can you take your underwear and your pants off, cover up with the sheet, and then I'll be back in. When I come back in, I'm gonna be assessing your belly. So again, I want you to feel comfortable. If at any time you don't feel comfortable, remember, it's your right as the patient. You can say, we can stop for today and we can continue next time. So as I'm assessing, I'm looking at your belly. You may have heard of DRA or diastasis recti. That's the separation of the abdominal wall. I'm gonna be looking at that. Then I have you lay down and I have you spread your knees and cover up here. I'm gonna look at the pelvic floor. I'm gonna look at it on the outside. I have gloves and gel on my finger, and I'm assessing the muscles on the outside. There's 3 layers of the pelvic floor muscles. Then, if I find any tension or restrictions or tender spots, I treat it right away. It's completely different than going to your OB-GYN and doing a pelvic exam. I don't use a speculum. Then we proceed to go internally vaginally. At this time, again, I'm assessing for any movement of the bladder, uterus, or rectum, which can be described as a prolapse. I'm looking for any weakness. I have you do a pelvic floor contraction that is also called a Kegel. And then I have you also bear down so I can see that movement of the pelvic floor. And then I assess the pelvic floor. The pelvic floor muscles are like a bowl here. There could be tension, just like you would up here on your neck, you would have those on the pelvic floor. As we're doing this, I'm doing a lot of education, so you're understanding your body. And then we come up with a treatment plan, a diagnosis, what's going on, what's the cause behind these symptoms, and what is our plan going forward. Typically, I see a woman 1 time a week for 4 to 6 weeks. Again, it just depends on your symptom, your situation. Every treatment's unique. And within that first visit, you're also getting a treatment plan so you know what you should do between now and your next visit. And that's what you can expect in pelvic floor physical therapy. I hope that's helped you and calmed your nerves, concerns, and you go in more prepared for your pelvic physical therapy evaluation so you can meet the health goals that you want to achieve.